Thank you very much. We just listened to two very memorable talks by Dr. Devashish Saini and Dr. Madhusudan. And as Dr. Madhusudan very aptly said, whether we want it or not, we are in the Kurukshetra. And what is the Kurukshetra battle about? It is, as I see it, a battle between two things. One is the values of patient-centered family practice, and the second is about enhancing the value with technology. Whether we like it or not, we are faced with a unique situation. The first situation is that change is inevitable. The way family practice, primary care practice, medical practice, healthcare, the way healthcare was 10 years back, 20 years back, it will not remain the same. The second is that whether we embrace technology or we fight technology. Like Dr. Madhusudan said, he bought his first computer 22 years back. Technology is here to transform almost every aspect of our lives and every aspect of our practice. So today's talk, today's panel discussion, I will be moderating. I'm Dr. R.K. Prasad or Ramakrishna Prasad, will be the reimagination of the post-COVID-19 pandemic era and how primary care transformation will be accelerated. Next slide, please. There are three main objectives today. And the panel discussion itself, the speakers are very interesting people. We have a very interprofessional team. There's a lawyer who is a technology and intellectual property lawyer. There's a clinical pharmacist. There's a physician who leads a home-based primary care team, and myself who has a deep regard for patient-centered care. So we have three objectives. Objective number one, recognize, all of us need to recognize as family physicians that we are passing through a phase of transformation of healthcare driven by accelerated adoption of novel technologies. The second is I want you to appreciate three fundamental practice shifts. And some of them may even be discussion points when pitched against Dr. Devashish's points. The first is, I believe, we all believe, that there is a shift happening from the hospital environment as the main place where care happens to the home environment. We saw this during the pandemic, COVID pandemic. Telecare is something you deliver from home. The second is there's also a shift happening from solo practice models to team-based care. The third shift which is happening is from a single system practice model to integrated and interprofessional models of care. Lastly, we want you to leave with an understanding of how integrated, value-oriented superhighways of next generation primary care practice networks are emerging. Next slide, please. We've all been introduced. It's really my pleasure to be with this team. Next slide, please. At the heart of the Kurukshetra, as we spoke, is the fight between values and value. I completely agree with Dr. Devashish when he predicted that in the next decade, there will be an increased recognition of the value of family physicians. I completely agree with that. I also completely agree with him when he said that there will be an increased recognition of the values of family medicine, which is patient-centered care. Now, what I'll ask my colleagues, Dr. Ashoojit and Dr. Prathamesh, who lead Aviksha, who are the founders of Aviksha, a home-based primary care service, is what are the shifts emerging in healthcare practice and the ecosystem around it, and how does one navigate and ensure that the values of patient-centered care are delivered? Over to Dr. Ashoojit and Dr. Prathamesh.
Thank you, Prasad, for the nice introduction to the work we are doing and the shifts we are going to see in the healthcare in our coming era. looking at what you said about how the values and the value of family medicine, how we are going to sustain that with the shift in the entire healthcare practice, where you spoke about the fundamental shift of shifting from a hospital to home, a solo practice to a team-based practice, and a single system practice to the integrated system of practice. Can I go to the next slide, please? So this is a model of practice, which is Aviksha, which is a home-based primary care. If you see the chair there, which is signifying a person at home, it's the comfort of home. And we started this about a year and a half, almost 2 years ago, in April 2019, when we thought of taking our practice to the home of the patient. And this started with my being mentored in palliative care, where the palliative care was a home based care. And that's when I started thinking about taking the entire family medicine practice to the home of the patient. And we started this with a multidisciplinary team of a physician and a clinical pharmacist and a psychologist to begin with about 2 years ago. With now we have extended with the team with a physiotherapist who comes along. There's a nurse who comes at times with us or at times wherever the need of the patient is. We have tie-up with, we collaborate with companies who are into caregivers. So they train people as being nursing aides, and wherever it is required, then we collaborate with them and get a caregiver being placed at home. We have a very strong network of specialists and hospitals where we refer our patients and get referred back from the hospital to us as family physicians. This helps us in the continuity of the care of the patient and the family. We have collaboration with laboratories across Bangalore, where we ask the people to go to their home and collect blood samples. We have a person who takes a portable X-ray machine to get X-rays done at home. This has really changed the face of family medicine and home care. Now, coming to our vision of Aviksha, we envision a healthy communities through teams providing person-centered primary care with passion and the comfort of people's home. So, I think the vision states that we can the comfort of people's home. So, is to deliver world-class careers and not merely years to. I think the vision stays in our vision. Our mission is healthcare services to people and not merely years to life. How do we sustain our values? We inspire primary care practitioners, home-based primary care as their own mission and grow through them. And how do, can I go to the next slide, please? Can I have the next slide, please? Yeah. So I'm just telling in short our experience of how this value is transmitted and how this value is maintained. We had a patient, a 75-year-old, who had started having dementia at the age of 65. The wife called us to come and visit him as she was referred to us by a psychiatrist for a home visit. And when we went and visited him, she said, my husband is all the time obsessed with wearing his clothes on. He sleeps with the same pant, the track pants. At night, sleeps with his shoes on, doesn't want to take it out, and gets aggressive if you ask him to take it off, and hasn't had a bath or doesn't wash his hair for last 3 months. And his wife, she said that I don't want to give him medications which have been prescribed by psychiatrists because it will make him a zombie, and I don't want my husband to be a zombie. These were her exact words. Now, while I was talking to her, I said that, ma'am, it's important that we give medications to your husband, It is not to treat him, because I do agree we do not have medications which can reverse his dementia or stop the progression of dementia. But we need to calm him down, because I can see that you are so stressed and you need to relax. You need to have a time for yourself. You need to take care of yourself. It's important. And that's when she said, oh, yes, I do understand. And I think I'm stressed because my blood pressure has gone up. I have started medication. I had an aneurysm because of which I have lost my eyesight in one of my eyes. And the next visit, before I could go for the next visit, she called me and said, Doctor, you spoke about my health, and you suggested that I meet the psychologist. So, can I have the psychologist appointment as well? And the next visit, we took the psychologist along with us, and she has started undergoing counseling therapy sessions. So, this is what home based care can provide, how we transmit values, how it is transmitted through the multidisciplinary team. And we have also introduced an Ayurvedic doctor to her, who is a part of our team, because we suggested that if she would like to have Ayurvedic treatment for her husband, as there is no allopathy medicine which can stop the progression of dementia or reverse the dementia, but he needs to calm down. And he went to the Ayurvedic hospital and underwent a head massage with a hair wash. And he's much better today after about 10 days of Ayurvedic treatment as well. So we are giving Ayurveda, as well as he's on Olians for his psychiatric problems. So can I go to the next slide, please? So this is our integrated practice model, where our core values of Aviksha is empathy, patient-centered or family-centeredness, integrated team care, and holistic approach to the care, and humility. It is very important that when we go to a person's home, we have to be very, very humble. We cannot be like physicians who sit in the clinic and say that, speak very differently. Here we are leaving our comfort zone and approaching a patient at their home. These are the three corners of stones of Aviksha, which you can see. One is the clinical care with the integrated team, the training, where we have training and fellowship, internship, and career mentorship. Career mentorship offers is for the college and the school going students who want to take up medicine in future. And we have the third cornerstone is integrating home care into the health system of India. This is through research and policy. Now, I would request Dr. Prasad to take over from here.
Thank you, Dr. Ashoojit. Can I have the next slide, please? So Dr. Ashoojit spoke about the values of patient-centered care. Now I'd like to request Advocate Prasanna Bhagwan to speak about the role of technology and how technology has the potential to transform primary care and can do so with accelerated adoption of certain ideas. Advocate Prasanna Bhagwan, over to you. Thank you.
Thank you so much for inviting me to this August gathering. Am I audible? There had been a call drop in between. Am I audible to all the listeners?
Yeah.
Okay. Yes. So can I have the slides, please? Can I have the next slide? Can I have an earlier slide? Even before that, maybe 3 slides before that. Maybe slide number 12.
Actually, just a quick comment. Dr. Prathamesh, quick comment. Dr. Prathamesh had a comment on the next one slide. I'll just let him have the comment before you speak, Mr. Prasanna.
Can we go to the next slide, please? Yes. So telecare has been a major component, especially post-COVID era, wherein most of the patients have been getting onto the teleconsultations with the doctors to access care because they were not able to move out of their homes and because of the lockdown and things like that. again, we use certain model like an eco model, or the thing that was subjected by Project Eco, wherein there is this holistic network of specialists at the back end, and the patient can rightfully approach clinicians over the teleconsultation program. We started the telecare part of it with our clinic back in 2017 when we initially initiated the clinical practice. But soon after that, we also incorporated it into our home care, and in the recent times, it has exponentially gone up along with our home visits. Can we move to the next? Yeah. So designing a data system basically comes in with the patient in the center and a data system that would capture most of the essential needs of the patients, along with the needs of the specialist or the physician who is treating the patient, to have that diverse backup of data available both for the clinician as well as the patient to provide the holistic patient-centered care. This would be through the processes of continuous research, which would be going all across and continuously as the patient keeps coming to the physician. Can we go to the next slide? Yeah. So assessing the root cause is a major thing. Again, finding out what are the cross-domain problems and solving them with the right approach, especially a team-based approach, can help this in most of the ways. Many of these EHRs are basically reliable, but they are not that accessible to most of the people because doctors hesitate to use the technologies due to several things like confidentiality, patient confidentiality, and how the patient can retrieve the data and go have the continuity of care at multiple locations. Also, the lack of personalized technology or data capturing tools uh, put a drawback to this. Most of it being patient centered, we would look at how these technological aspects and financial innovations in healthcare would actually promote patient-centered care. So I would request Dr. R.K. to take it from here. And
Thank you, Dr. Prathamesh. Thanks for adding that. That's a critical piece. Mr. Prasanna, please take it from here. The next slide, please. The question we're looking for your inputs on are how will technological innovations, market trends, and space-time analysis, what is the change and how will technology link up with the values of primary care? Over to you.
First of all, thank you everyone for inviting me to this August gathering on family physicians. I have been in this field since more than a decade now, and being a lawyer, I had also been an inventor in this field. So whenever we talk of innovation, it had always been what the government had been doing or what the small labs had been doing or what already exists being given by big brands. But when we look at a primary healthcare, we found out that there is a lot of space in that in which there is still a need for a lot of innovation, inventions. And whenever we talk of innovation, we are talking at three different levels. Apart from clinical, the clinical needs technology help, it needs management, it needs law. It needs to have an entire holistic approach for the entire thing. So whenever we say technology, we mean to say tech also needs management and law. So that is a part of the financial innovation. And there is a clinical part which is talking about diagnostics and therapeutics. And the other part it basically talks about your legal and your the policies as to how they are being made. Can I go to the next slide? Can I go to the next slide? Okay, so this is the slide I was talking about. So these are all interfaces in which we are talking about. At the center of, can you go to the earlier slide? Can we go to the earlier slide? Can we go to the earlier slide?
A previous slide, please.
Previous. So at the center of it is patient, and it is the patient who actually needs all this data, all this information, all this innovation. Until and unless a family physician basically connects with all these things, there is a very less likelihood chances of primary healthcare taking a center stage. Okay, so we'll look at some of the news that had been around. So we'll go to the next slide, and we will see what is the news that is going on. Can we go to the next slide? Next slide, please. Okay, now this is a recent news article which has just come up 2 days ago. So we'll go to the earlier slide, previous slide. So shall we go to the previous slide, the earlier slide, the slide before this one? So just slide after this, just a slide after this. Okay, I think there had been some technical lag from here, and so just taking some time for the slides. So this is a recent news which is basically talking about, there had been a lot of buzz about this, that the government must spend a lot of money in the healthcare innovations and everything else. And just a day old news basically says that the Nirmala Sitharaman in her budget must focus on healthcare. So there had been a lot of debate on this since more than 7 decades. We can have it, which basically says that the amount of spending by the government on the healthcare is very, very less. So one of the economic models basically tells us that until and unless we pump in a lot of money into that through economic stimulus and everything else, this entire ecosystem is not going to change. But when we look at the economic models, we found out that there is no guarantee that the government of India is going to pump a lot of money into this, that the primary healthcare is going to get benefited. So where does the sweet spot lie basically? We'll see that in the upcoming slides and the innovations that are happening around. Can we go to the next slide? Slide number 14. Okay, see, we all, as a family physician, you all people have been practicing. No, sir, we are going to only slide number 14. Only slide number 14. So in slide number 14, I'll talk about slide number 14. So we all have been using, so only slide number 14. So we had been using, diabetic, drawing blood and everything else. Then the glucometers have come in the market. So we basically prick the patient has to basically prick. Can we go to slide number 14, the earlier slide after the news article? Yes, please stop at this slide. Yes. So we have always been using this prick a needle. Now look at the cost analysis. Each prick basically is costing you 25 rupees per prick. So you have to pick in the prick in the morning, and you need to find your glucose. Then after food, after 2 hours, then again you have to prick and you have to find out. Now look at the way innovations have been happening. Now this is available in the market. You just need to attach it as a patch on your, to your biceps. And then you'll find out that the machine is actually reading your glucose every 15 minutes. And it reads for a 14-day cycle, and the new machines are available which can read for the entire whole month. Now, when I go to the doctor, my primary healthcare doctor is much more aware about my dietary pattern, because he understands that, okay, whether there was an increase in sugar when I ate my brown rice or when I ate my white rice, I need not convince my patient. Or when I ate something which is non-vegetarian or when I ate vegetarian. What is the kind of meal? High complex carbohydrates versus high fat food. How is it impacting? In a normal prick, it becomes very difficult for a patient to prick every time and find the data. Now, these kind of machines are giving you pinpoint accuracy, and it is reading the entire data without actually interfering and the patient getting involved in this entire thing. Shall we go to the next slide? Okay, now this is a sensor, a wearable device. If I attach it to my waist, to my pant or something else, so what does it do? It's a fantastic piece of innovation. So what does it basically do is it starts reading your impulses. Now, what does it tell you? It starts reading your body from day one. Now imagine I have a call from person A, B, C, D, 4 different people. So the machine starts reading it and says, oh, so when you got a call from person A, you are more anxious. When you got from the person call B, you are much more calmer. So it reads the entire pattern. It reads when were you more productive during the day? Was it in the afternoon or was it in the evening? So when I go to my doctor is already having a lot of data. He says, okay, so my app tells me that you had been more productive between 12 o'clock to 3 o'clock in the afternoon. Try to plan your important works during that time. Can we cut down the stress? Can we give a more realistic data as to what is in our hand? So these machines are actually doing a lot of information, giving a lot of information, real-time information to the doctors, which will be really helpful as to what time had they been more anxious. Should they go walking in the morning or in the evening? At what time should they go? To that extent, it can basically tell you. It can also help you in focusing on your work. Can we go to the next one?
Just a reminder on time. We have Mr. Prasanna, 2 more minutes.
Oh, okay. Okay, so this is a smart belt. So what does the smart belt do is whenever I wear the smart belt, the battery lasts for around 60 days. So it can actually tell me the waist size. It can also tell me how long had I been sitting. It also tells me how many steps did I take. So whenever I go to my doctor need not say, hey, you look at your BMI and other things. He can just say, hey, look at your waist size. Your belt is speaking for itself. So that will give you a lot of information. Can you go to the next slide? Can we go to the next slide? Yes. So this is a fantastic piece. This is basically a sensor. It consists of say around 13 sensors that when you wrap around a belly during pregnancy, it includes all kind of information, starting from acoustics, your ECG machines to the heartbeats to the kicks and everything else. This will give a lot more information to the doctor than what the primary healthcare is basically missing, doctors. So this is going to be one such machine which is available in the market and is a fantastic piece of inventions. So when we look at the markets, can we go to the next slide? We look at 5 phases of product development. What happens is there is something called as technology trigger. So what happens in a technology trigger is there is a need, necessity in the market. So there is a trigger in the market. Then there is something called peak of inflated expectations. So we all expect the product to be successful. We want everything else. We see great happening, everything else. Then there is a thought of disillusion. You can see that, yes, disillusionment. You can see that. Then there is a slope of enlightenment. Then there is a plateau of productivity. So what happens is the technology acceptability goes through its own peaks and eventually it gets accepted. Now we can see that in case of a primary healthcare, how it had been doing in terms of various different technologies, which we have mapped from the Gartner chart which is available. Can we go to the next one? Okay, so these are wearable technologies. You can see that a lot of technologies have come up. Some of the technologies have failed. Some of the technologies have been successful. But eventually in the productivity life cycle, you'll understand that the plateau of productivity, the moment it reaches, a lot of these technologies start getting adopted. Now, what COVID has actually done is that has reduced the time space, the time of technology adoption by the patients. Now, earlier it was way too high. Now it has reduced. Now the primary healthcare need not go to the patient and say that, there's one piece of fantastic technology. Why don't you use it? Because I'm going to get a lot of data. It has become much more easier for me to manage and maintain your health. So can we go to the next one? Okay, this is a fantastic platform. This is Blue Dot and there's ProMed. And Blue Dot had been one such platform which has successfully predicted 3 pandemics before time. The amount of data that Blue Dot has, that is terrific. And primary healthcare, it's going to be a game changer for the entire primary care. Then there is ProMed. ProMed is basically an international society for infectious diseases, and these people have a lot of information in real time as to how things really change. Can we go to the next slide? Okay, this basically tells you about the blue dot. In 2014, they had predicted about the Ebola. Then they had 2016, they had Zika. 2019 too, they talked about way before pandemic broke out. They actually predicted that there's going to be COVID-19. So this kind of information is very valuable for everyone when we are in a healthcare practice. So I call Dr. Ake to about for the next slide.
Thank you very much, Mr. Prasanna. Next slide, please. So just to conclude, I think to continue the Kurukshetra metaphor and conclude with that, the battle is actually to derive value, enhance value of technology, but while retaining the values of patient-centered care, the values of family medicine. So thank you all. I think we've run out of time. If there is a minute or so, we can take questions. Otherwise, any questions which are sent to us, we will be very happy to answer and respond back to individuals who ask us questions. Thank you very much.